afternoon, everyone. For anyone who doesn't know, my name is Michelle Graham. I do work at National Rehab Equipment, and I have so now for 10 years. And it started when I had an EB mom approach me, and she was using someone else and was having some difficulties getting coverage. She actually said to me, "I've gone 3 weeks without bathing my child because I cannot get dressings." That was pretty much what sucked me in, and ever since then I have been fighting insurances to take care of ED patients. I have 15 years working with insurance companies, so I'm really familiar with fighting with insurances and working and dealing with the problems that they give everyone. Prior to National Rehab, I used to work for a hemophilia company, and I would fight to get medications for hemophilia patients. So it was more of a drug-related issue, but on the same level, it's still fighting with the insurances. Thank you very much. Sorry about that, everyone. What I'm going to do is I'm going to give everyone about 5 minutes and go over briefly some insurance information that is really important. It's what helps me to be able to navigate through your insurance and help you understand your insurance a little bit so you know what I do to work through these insurances. This knowledge is really helpful to me. We're going to start with going through some commercial plans, and there's 4 basic managed care plans in the United States. First off, you're dealing with an HMO. An HMO is the most strictest of the managed care plans. When you're dealing with an HMO, there is no out-of-network benefits. So you have no ability to travel with an HMO unless it's a medical emergency. They are state or county driven. So what I mean by that is if you have an HMO within a state, they may tell you can only see doctors, hospitals, and other providers within a county or state area. So they're very restrictive. You must use your PCP. You cannot use a doctor out of your network. If your PCP does not direct your care, you have no coverage. So they're like the gatekeeper. They open and close the door to your health care. On the other far end is the PPOs, which is a preferred provider organization. They are my favorite with the managed care plans, and the reason why is they give you the most flexibility. You're not required to have a PCP, so you do not have to have a primary care doctor direct your care. It is not state-driven. They will give you a network within your state, but they also give you the ability to use a larger network, which is what they refer to as a PPO network, which is more of a national level, and you can travel with these. So it gives you much more flexibility. If you stay within the network, you have the highest level of benefits. If you travel out of the network, you still have coverage, but you're going to pay a higher deductible and a higher copay, and et cetera. So it is one of my favorites, and I recommend these. If you have this option, this would be my first option with any plan. Going down, and there's a really popular plan in the United States, is the point of service plan, the POS. And I see these very frequently. You'll see some plans will refer to them as like an open access plan, or they don't really say they're a point of service, but they truly are. And what a point of service plan does is it has the best of both worlds. If you use it like an HMO and have your PCP refer you and take care of all your care and manage all your care, they'll pay at the highest level. But if you self-refer yourself and have the PCP not be involved in your care and say, I'm going to go to this specialist or this doctor, they will still pay, but at a different level, like another tier. And then if you take it another level and say that I'm going to use a provider out of that network, then there's another tier. So the levels keep dropping. They'll start paying at a lower level and another lower level. So it does give you the best of all worlds, but it truly is best used as if you're using it like an HMO. And now you have something that's not quite as common, but it's still something that's I see a lot of, and it's been popping up more. It's more than newer plans. It's called an EPO plan, or exclusive provider organization. And how this works is it being very simple. It's a PPO with no out-of-network benefits. You use the PPO network. You can travel with it. However, if you go out of network, you have no coverage. They may tell you you need to get a referral from your PCP, but they're verbal, which is really hard to bill. So it doesn't matter. You can pretty much travel with it, and it's very easy to use. Okay, to touch a little bit on Medicaid. Medicaids are obtainable in each state for children, families, pregnant women, elderly, and people with disabilities. It is based on income. So I'm sure everyone is aware that it is based on income. But in some states, children are still eligible for Medicaid if their family's income is higher. And if your income is even on a higher scale over this, they may be eligible for CHIP. CHIP is a Children's Health Insurance Program. Coverage does vary state to state, and what I mean by that is what's covered in some states is not covered in others. So if you've ever moved, you've probably come across that situation where you found out that you had coverage in one state and didn't have it in another. Some states do require copays, so that's probably the most you'll have is like a copay for a visit or whatnot. For information, there's actually a national number for children for Medicaid, and it is 1-877-KIDS-NOW, or you can actually get on their website, which is www.insurekidsnow.gov. And it's a national number for kids, and which I find is really helpful if you want to navigate through this. But I did want to say something a little bit about the Medicaid program, especially with the children within the EB community, and when you're dealing with under 18 or under 21, depending on the state. I have so many people tell me, I don't qualify. I'm not going to be eligible. I'm going to tell you my own opinion on that because I've come across situations where I thought there was a dead end. Don't ever accept no the first time. Most of the time you're speaking to somebody at a customer service level, there's always avenues, and they don't always advertise that there's other ways to get coverage. I've come across situations where there's a specific program that's not on their website that the Medicaid staff isn't aware of. So just because they've told you no, okay, you don't qualify this way, there may be a specific program that's set up specifically for skin diseases, or something that's set up for disabilities, and our special program that they just set up. So don't always accept no as an answer just because they said, well, you checked off this box, you have insurance, therefore you're not covered under Medicaid. Another thing I wanted to say on that is with the Medicaid programs, you need to be detailed with your information from your doctors. If you are going to apply for a Medicaid program and something is not covered by your primary insurance, if you want to try to get this insurance, these Medicaid programs, you need to make sure that from your doctor, your letters of information concerning medical necessity are detailed and explain why, not just a one-line paragraph. It needs to be why it's medically necessary and that it's something that they need for their quality of life. And I will also touch on Medicare a little bit too. Medicare is for people that are 65 years or older, people under 65 with certain disabilities, people of all ages with end-stage renal disease, permanent kidney failure, which requires dialysis or transplant, or Lou Gehrig's disease. Also, adults disabled before the age of 22 may be eligible for children's benefits if a parent is deceased or starts receiving retirement or disability benefits. Medicare considers this a child's benefit because it's paid under the parent's Social Security earning record. For more information on this, you can contact the Social Security office, which is at www.socialsecurity.gov. Call 1-800-772-1213 for further information. I know a lot of people have asked me about this. There's situations if you're not eligible for Medicare and you've applied for SSD, SSI, you would then fall under the most Medicaid programs within the state. Again, this is where documentation becomes really, really important, because once you hit this age, there's a lot of states that don't pay for certain dressings, certain supplies, certain coverage because you're over the age of 21. But I found in some areas in some states that you can advocate to get extra coverage. It's just knowing the steps to take and who to approach and who to and not to stop. Because I think a lot of people say as soon as they hear no the first time, they want to stop and say, okay, well, I was told no. And the one thing I found with everybody in this community, most people here don't stop. They keep going because they know how important it is. So that's the same thing I'm going to say along the lines with this. Okay, so this is something really big, and I think this is very important to go over, is you're considering new insurance. First thing I want to talk to everyone about is if you're getting insurance through an employer group or buying insurance, before you switch, and a lot of people come to me after they've switched. They've said, I'm switching coverage. Oh, by the way, it happened 2 weeks ago. And at that point, I can't fix it. I can only tell you what you have. But so the first thing I want to ask you guys to do when you find out that your insurance plan is going to change is contact me ahead of time, or make a list. And what I'm going to start with is find out if your plan is self-funded or fully vested. And you probably ask me, why is that important? Well, to understand first, if you are having an employer change, an employer group change, the difference between self-funded and fully vested is self-funded is when your employer pays for your claims. The insurance doesn't pay it, the employer pays it. When you're fully vested, the insurance company is actually paying your claims. And you may not realize it only because your cards look identical, but when you flip it over, there's information on the back of your card that may state you need to call this dedicated unit or information like this. But you can ask your HR department and they'll tell you if they're fully vested or self-funded. And I'll explain to you in a minute why that's so important. The other thing I want you to do is make a list. You need to make a list of what is important to you. You need to start from the top and say, I can't do without this. It may be dressings and bandages. It may be this doctor. It may be this hospital. It may be this prescription. But you need to be very specific and start making a list down of things that your insurance has to do for you. Because without that, you're accepting whatever they give you before the plan's even rolled out. The next thing you want to do is you want to contact all your providers. Once you've made this list, you want to contact all your providers to get all the billing codes. Say, I want to know what you bill for this supply, this service, this procedure, because you know that you're going to need this. So you get all this information and you put it on a sheet of paper and you bring it in. You give it to your HR department or your broker if you're going to be going through and buying the insurance yourself. And you say, this is what I need. So if they're looking over plans, they're offering you multiple different plans, you need to let them know, this is what I need. Can you tell me if these are covered? So if they tell you, and they call you back in and say it's covered, ask for a confirmation letter or tracking number. Say if the insurance company calls you up and says, yes, we validated this information, it is a covered benefit, and these codes are covered, ask them at the end of a call, and you may have had this yourself, where they'll say, would you like a tracking number for this call? Would you like a confirmation number for this call? You're going to want to get that. Make sure you write down everybody's name, the date you spoke with them, the time you spoke with them, and because you're going to need that information if something goes wrong. But if possible, get a recorded confirmation. A letter is great, saying that they're going to pay for these items. If the plan is lacking, and they tell you that these items are not on this, this is where the self-funded or fully vested information becomes important. If the group is self-funded, they can make adjustments to the plan. If they're fully vested, it's very difficult because a fully vested plan, the insurance company is selling you selling your insurance company, your employer a package, and they're saying this is the covered benefits, this is all you have, and you have to choose from packages. When you're self-funded, they'll give them a package, but the employer group can add things to it and take things from it. They can carve things in and carve things out. So your employer group can actually add those benefits if they're not in that package. So that's key. And if they value you as an employee, they'll do that. And if they value your child, and that's how I look at it. So there are exceptions that can be made to that. Another thing I want everyone to know is not all insurance plans are created equal. So before switching plans, talk to your friends, talk to your family, talk to your providers of care. Talk to your support groups, utilize all your resources, Facebook, Twitter, any specialized sites, and start talking to people like, this insurance, what about this insurance? What do you know about this insurance? As you know, there's many plans in the United States. And if you need help choosing a plan, I will gladly assist you. I get many people that call me and say, tell me, what do you think I should choose? And I'll go through all the plans that you're being offered, and I'll dig through them for you, and I'll tell you what I think is good for you. And making sure that you're getting the best care for your child for what is on your list, what is on your hit list. So now you've done all this, and everything looks perfect, and everything's great, and then your claims start denying. First off, don't panic, because Claims deny all the time, insurance companies. It's just part of the game. And first thing you want to do is check your EOB. You'll get an explanation of benefits either in the mail or sometimes they'll even email you depending on the insurance plan. It could be a really simple fix. So you want to find out who's responsible for the mistake. You're gonna, so be proactive. Don't let it fix itself, because it may be if it's a first-time mistake, you want everything to keep going smoothly, and you don't want to have to find out 3 months down the road that the problem never fixed itself and all your claims are denying, and it's something that could have been fixed up front. It's just easier to fix one problem instead of trying to solve months and months and months of problems. So first off is call your insurance company and ask them why they denied the claim. Then once you have the information of why they denied the claim, if something that it may be something that they need from you. They may say they just need you to update your information. But if they say from you that they need notes, clinical notes, or they need more documentation, you then need to call your provider and say, look, this is what I need from you so I can get this into the process. But make sure, write down everything. Write down everyone you speak with, from the insurance level to the provider. Make sure you take care of that, because it's really important to make sure that they know you're on top of it. Because an insurance company will not process your claim immediately unless you call them. It's just a process. They get so many claims a day that they're not going to reprocess. It's your phone call that's going to make that claim reprocess. The other thing I wanted to say is know your rights with your insurance company and your provider. And I say this because of the questions I get. Don't be bullied. If you get an EOB in the mail and it states no patient responsibility, and you get a bill from your provider, there's something wrong. If you get an EOB and it states no patient responsibility and your provider bills you, you need to call your insurance company, because they're not allowed to bill you. If the responsibility of the patient is zero, then your responsibility is zero. And many times, people overlook that because they just don't look at their EOBs. But it's key to know if you got a bill in the mail, should you have been billed for it in the first place? The second thing is, if a provider drops you and calls you and says, because your claims aren't getting paid, so we're dropping you. You need to call your insurance company and find out first off why they're not processing the claims. Because chances are it's something that's for documentation, medical information they need. And then the second reason you want to call them is because they're truly not supposed to drop you if they have a contract with your insurance company. So they can get in some trouble in some instances depending on their contract. They can get in trouble for just dropping you. They're supposed to, if they contract with your provider, they're to take care of your services along with everyone else's. So they're not allowed to drop you and keep someone else going. They're not supposed to be allowed to do that. But it is different with some contracts, so definitely call your insurance company and let them know. The other thing, though, on the flip side, is insurance companies are supposed to process claims. It is, in certain states, there's clean claim laws. So if they're not processing your claims, you need to let them know everything's been handed out, everything's been given. If you don't process my claims in 45 days, I will call the state insurance commission on you. It's very easy. It's an easy phone call, and they don't want to get fined. So it's enough to keep them motivated to make sure your insurance, everything processes and gets taken care of. If anyone has any questions or needs a consultation and just wants to talk to me about insurance questions, you can call me at 1-877-567-8468 at extension 5319. And if you have any wound care product questions, you can talk to Bill Corman at 5318. Also, you can email the NR EB Advocate team at ebadvocate@nationalrehab.com. You can also visit our www.ebnurse.org. On this website, there's a spot on the website that says Ask Bill or Ask Michelle, and you can get us directly and email us, and we'll respond back. If you'd like, you can go onto our EB Advocate on Facebook and like us, or subscribe to the EB Advocate newsletter. And that is it. So.
thank you. Any questions for Michelle?
This may just apply to me, so if it does, just you can catch me later. But
you can ask any questions.
Jonah has been denied his special needs once he got 3 years old and became property of the school system. And so I'm wondering now, like, I don't think a private preschool, like a church preschool or something like that, is going to feel very confident in taking him because of the liability. I'm wondering, is there anything within Medicaid, North Carolina specifically, if you know, North Carolina Medicaid or insurance that would pay part for a one-on-one aid for him or something like that? Or how do I don't even know what avenues to pursue, I guess is what I'm saying.
Do you have a contact that you deal with directly at North Carolina Medicaid?
No. I hold for a long time.
Okay. I can definitely do some digging for you on that, because every Medicaid is different and they require certain things, and some will pay for certain things and some will not.
And will private insurance do anything on that too?
They may.
Because he has Medicaid secondary, so we do have insurance.
They may. It just depends on the policy. Okay. Again, it depends. Again, when we talked about that self-funded, fully vested kind of deal, even if it's excluded, it may be something they're willing to add.
I'll email you.
You know. Okay. You can definitely do that.
Any other questions?
They're in every state. So all you have to do is go on the website of the state website, and it'll actually have the insurance information right there, because all your HMOs are on that website. You can click on it and see it, because they're all registered within the state. And if they don't follow certain guidelines, they can get in trouble. So, great. I thank you, everyone, for your time. I am going to announce the name for our gift basket. So it is David Jones in Hamilton, Alabama. Is it you? Great, you're in here. That's wonderful.